Thank you, Naomi, and thank you, Roger. It is my immense pleasure to introduce Professor Dame Marilyn Waring, Professor of Public Policy at Auckland University of Technology from, of course, Auckland, New Zealand, Aotearoa. Marilyn is a New Zealand feminist, former politician, author, academic and activist for female human rights and environmental issues. She's best known for her 1988 book, If Women Counted, and she obtained a Doctor of Philosophy in Political Economy in 1989. Through her research and writing, she's known as the principal founder of the discipline of feminist economics. She's outspokenly criticised the concept of GDP, the economic measure that became a foundation of the United Nations system of national accounts following World War II. She criticises a system which counts oil spills and wars as contributors to economic growth, while child rearing and housekeeping are deemed valueless. Her work has influenced academics, government accounting in several countries, and United Nations policies. In 2020, Marilyn was appointed a Dame Companion of the New Zealand Order of Merit for services to women and to economics. So you can see why I'm so thrilled for Marilyn to be with us. Please welcome Marilyn Waring. Over to you, Marilyn.
Tēnā koutou katoa. Greetings to you all from Aotearoa, New Zealand. And thank you, Julie, for your invitation to be part of Alive and Thrive launch. Now, for me, a singular characteristic of Julie's work for 20 years has been exploring strategies to change the paradigm, which attributes no value to breastfeeding. And I'm excited to hear from the number of specialists who are going to share with us how the tool will help their work. Julie's work has traversed an extensive range of political questions, and these have been pursued with a rigour energised by a passion for the rights of women and children, but informed by early years working on the inside in the treasuries of both New Zealand and the Australian government, and in ministries of finance, Prime Minister and Cabinet, Environment and Water. But I don't know any other economist with certificates in breastfeeding education. Now, just 6 days ago, the World Health Organization advised that formula milk companies paying social media platforms and influencers gain direct access to pregnant women and mothers at a vulnerable time in their lives. And throughout the pandemic, this pervasive marketing has been increasing the purchases of breast milk substitutes and dissuading mothers from breastfeeding exclusively. Dr. Francesca Branca at the World Health Organization described the marketing as powerful, insidious, and inexcusable. And has been mentioned, the sale of substitutes and the marketing are all seen as good for growth in the economy, while the best food on the planet counts for nothing. In 2021, I was invited to become a member of the World Health Organization Council on the Economics of Health for All. And I want to share some parts of our recent paper on valuing health for all and rethinking and building a whole of society approach. So we wrote, if health and well-being are within the reach of every person on this planet, and health for all is the goal, then what do societies need to value to achieve this? And how do we create metrics to steer and evaluate the reshaping and redirection that the economy must undergo to achieve health for all? We recognise that, quote, no universal metric can encompass all the diverse components of health for all, especially not a monolithic monetary measure like GDP. So we must move toward data collection and measurements globally that abandon such indices and alternative metrics, such as the tool that value the health of people and the planet along multiple dimensions through a full spectrum holistic approach is what we need. And these metrics need to include, these frameworks need to include new metrics, not just lactation, but the food growing, the cooking, cleaning, childcare, unpaid household and community activities, including environmental conservation, overwhelmingly performed by women, all of these tasks. And time use data can help reveal a lot about these hidden activities and begin to capture their true value and to support policy making in a number of ways, including in-depth knowledge of what requires additional investment, which is another target, another strategy around this tool. The council didn't waste words. We described, quote, a pathological obsession with gross domestic product, an inappropriate measure of progress that perversely rewards profit-generating activities that harm people and destroy ecosystems. So Mother's Milk tool we launched does value and measure women's productivity. And yes, it is very strange that in the national income accounts of New Zealand, the milk from sheep, goats, cows, and buffaloes is counted, but the best food on the planet for infants, mother's milk, counts for nothing. However, we walk a very fine moral and ethical tightrope in the strategies we use to call for redistribution of a government's financial resources to those who do the most work. When I wrote the first edition of Counting for Nothing, 1987-88, I did argue that we should make monetary estimates of all unpaid productive service and reproductive work, including lactation, and estimates of environmental services in the gross domestic product. I could see that if this happened, that would overwhelm the national accounts framework, and we might have to go back to ground zero. But the Statistical Commission also recognised that and set up satellite accounts for the work mostly women do that lies beyond the production boundary and for the environment. But as I gained some distance from parliamentary office and the GDP paradigm that governs our nation's annual budgets, I recognised I did not want to see the characteristics of our planet and our lives, which are of an inestimable value, included in a national accounting framework which rewards war, slavery, trafficking in people, drugs, armaments, ecological devastation, named growth and progress. And I want to mention my World Health Organization colleague, Maxime, who is trying to join us tonight from the Ukraine and who understands the incredible rise in GDP productivity that is occasioned by war. This paradigm is not a path forward. In the first days of the COVID pandemic, it demonstrated that politicians had to call on and make judgments across a wide range of data from many sources. They should not return to GDP. We do not want that business as usual. For example, an environment is best measured by its natural characteristics, as we do in health policy with air and water, for example. From Julie's earliest work, the environmental impacts of breastfeeding vis-a-vis milk formula have been a focus. And I understand the planetary health aspect is to be developed as an environmental add-on to the tool. Unpaid work, all of it, including that's supposed to be collected in subsistence work. There was a change in the rules of the boundary of production in 1993, but that's all that changed, the rules. It was never carried out in practice. And this work is best measured by time use. And a woman's time investment in breastfeeding calculator is also to be added to the tool in the future. Now, most people online understand that the sustainability of the health system depends on women. The gross domestic product paradigm uses unpaid women to cut health costs, to achieve a much wider coverage of healthcare, and to reduce pressure on the health system. There are satellite accounts for unpaid work that use market estimates of time use. As I've made clear, it's not a path I like, but let's make clear they're all grossly understated. Time use data seldom counts simultaneous activities, which is a common and efficient practice of most women. But not counting simultaneous activities, the estimates are much lower because they underestimate productivity. I certainly know women who multitask when breastfeeding, and some of that multitasking actually is another point about the estimates not accounting for worry work, the daily work that can't ever be postponed, the organising, the logistics, the management, the administration of a household and its members. The estimates usually use proxy wage values that mirror women's pay inequities. And the data obscures really significant fishing, agriculture, horticulture, conservation, crafts, manufacturing and maintenance were done by women who don't live in cities or easily accessible rural areas, who are seldom counted for all that they do in the Census of Agriculture or the Household Labour Force Survey, and they're not an easy target for under-resourced time use studies. And the market estimates approach has often reduced the complexity of the tasks that women do unpaid to household or care work without understanding the specialist skills that are frequently engaged. And in 2019, writing on the tool for estimating economic losses from low breastfeeding rates, Julie recognised this. 2 of her 4 key messages were that the tool excluded additional unpaid household care, sick children, and that made the tool conservative, and that proper accounting of those costs requires more adequate time use data. Now, I'm trying to differentiate unpaid healthcare work from this generic term of care work, because unpaid healthcare work for those who are fully dependent has particular characteristics, and it's not covered by the everyday routines of cleaning, laundry, cooking, housework. So Duran has noticed that it includes, for example, pre-diagnosis, providing medicines, monitoring symptoms, checking vital signs, look at sometimes making herbal curative treatments, often transportation, liaison services with any form of health system, obtaining medicines, making payments. Full-time unpaid care of dependents demands constant availability, constant responsibility, and constant management. It can't be postponed. And the pathetic economic estimates of the market value of doing this work are degrading. The responsibility is immense. Everything that would be done in a care institution for dependents has to be done in the home without economies of scale. The Alive and Thrive initiative will celebrate what women contribute to health for all from pregnancy and birth. It will also assist so many advocates with data they don't have. Congratulations to you all. And I look forward to hearing from so many perspectives about how this change will, what change this will make in the lives of women and children.
Thank you, Marilyn. We are so privileged to hear your thoughts on the tool tonight, and I so appreciate your wisdom cast on our endeavours, and looking forward to seeing how these things play out in WHO and of course in the United Nations type forums.